On this episode of TLC Connections, GT Freeman sits down with Rob Delonzo, Senior Vice President of School-Based Services at the Lincoln Center. Rob reflects on the moments, choices, and connections that shaped his journey into mental health work, from early formative relationships to years spent in high-intensity crisis settings. Together, GT and Rob explore what it truly means to walk alongside people in distress, the importance of systems and relationships in healing, and how hope, meaning, and personalized support can transform lives.
Good morning and welcome, Rob Delonzo, to the TLC Connections podcast.
I'm excited to be here, GT.
Are you really?
Well, sort of.
Sort of?
Yeah.
You don't like these kind of things?
Yeah, it's formal. You know, you have to say official words and say it in a nice way. It's probably not my way.
You gotta wear a jacket.
Gotta wear a jacket.
Right.
I don't know how authentic I'm being right now, but I'm gonna try my best.
Yeah. We're here to talk about the Lincoln Center.
Oh, great. It's
And
my favorite
our
subject.
slogan at the Lincoln Center, or vision statement actually, is transforming lives and communities, one moment, one choice, one connection at a time. And so I want to zero in, kind of start the discussion by zeroing in on those three terms: moment, choice, and connection.
Yeah.
And so as you think back on your life, and you go back as far as you want, you go all the way back to middle school if you want. I'm not sure I can imagine a middle school Rob, but middle school, high school, college, early adult, reflect on a particular moment in time, or a choice that you made, or a choice that someone else in your inner circle made, or a connection that you made that kind of just established, like, it was like the first of many ripple effects, what we call the butterfly effect, that like cascaded to a series of events that drastically kind of changed your trajectory or changed your life.
Yeah, that's a great question. I love that question. I am going to answer in a way that you're not going to like. I'm gonna go back earlier than middle school.
Like 3 years old?
I'm going to go back before that.
Okay.
So I am I am a fraternal twin.
Okay.
And I think that is probably the biggest shaping moment, the biggest shaping component in my life. Yeah. So, I mean, I think that was a core foundation to how I perceived relationships. It helped me develop my own identity. It helped me establish really strong empathy skills and awareness skills of others, putting my own needs aside and looking at what other people need, and just building a trust and like a solid understanding of the universe through my relationship with my sister.
So you're saying you were close to your sister?
I remain close with my sister,
very
even
positive
after all these years.
relationship, because some siblings are like rivals.
Yeah, we never really went through that. That's amazing that we never went through that. So we shared a lot of the friend groups growing up. We just really always got along, had great parties together, and just trusted each other and looked out for each other throughout our lives, and something that will continue.
What's your earliest memory of your sister?
Well, I don't. We've done so many things together, but I remember some awkward moments where we took photos and we were wearing matching outfits. Now, we were brother and sister. Why would you have like the same outfit for both of them? So those were embarrassing moments that we shared together.
Right.
But yeah, I mean, she's a really loving and caring person, and I think that.
Would you say she was your best friend?
Absolutely, growing up.
Growing up.
Yeah.
And
yeah. But I mean, so that served as a core foundation for who I am today. But I feel like there were pivotal people, mentors in my life that sort of had an impact. I remember a professor at Syracuse. I went to Syracuse undergrad, and his name was Dr. Brain, and I'm not joking, Dr. Brain. And it was spelled B-R-A-E-N. But we did monkey dissection in this anatomy class. He was overseeing that, and I thought, here is why this field makes sense. He was connecting the physical parts of the brain to what we do, how we think. And then there was like a light bulb that turned on for me, because it was like this physical element and all the psychological elements sort of merging together. And that was like just a fascinating moment for me and sort of inspired me in the field.
What year was that?
We're going way back.
No, I mean, not the actual year, like freshman year, sophomore year.
It was my sophomore year, so I think, but I could tell you the year.
We don't need to know how old you are, Rob.
Dude, I'm so old. Dude, I'm telling you anyway.
So,
1985, I think it was.
1985. You were a sophomore at Syracuse. At what point did you know you wanted to go into the field of counseling?
Yeah. So I think I have always been a people person, and I went in with a psychology major, and that was sort of my focus. So I took a lot of psychology classes, and I just had some good professors, and I think just that desire to connect with people and want to help is something that I've always done and throughout my life. I decided that I was going to work in between my undergraduate and graduate, so I took a position which is sort of funny. I had not worked in the field, but took a position as a supervisor at an inpatient psychiatric facility. Like, why would they hire somebody with no experience? That was the desperation that I guess they had an opening there. So I worked at an inpatient psychiatric hospital as the second shift supervisor, and it was a blast. I had a great time, loved the experience, worked with a wide range of diagnostic issues, worked with people and on a multidisciplinary level, really learned about what I didn't want to be and what I wanted to be through that process. And probably about a year and a half into it, I realized that I had to further my education.
Tell me about that work experience. You said you had a blast. Like, what were some of the moments that you remember?
Yeah.
Or connections that you made?
Yeah. So, we worked with people that were struggling with schizophrenia. And so I had to, I'd built really strong relationships with the clients. And at one point, I remember one of them running in, screaming hysterically. She was crying. She was beside herself, hysterical. And she said, "You have to come into my room." And we go into the room together, and she goes, "Look under the bed, look under the bed." And I don't see anything under the bed. It's like clear. And she goes, "Do you see it?" And I go, "No." I go, "Well, tell me what you see." And she said, "Jesus is ripped apart. He's bloody. He's all over. You have to do something about it." So I proceeded to mop up Jesus and help her get through the moment and help her get through the struggle and this hallucination that she was dealing with. And so to me, that was like sort of a defining piece where it was such a reality to her. And if I minimized that, I would not have made a connection with her. It would not have de-escalated her. She was in a moment of terror, and I just saw the authentic, struggle that she was having.
You were young and just bachelor's degree at that point?
Yeah, I was making it up as I went along.
Wow.
Yeah, and I remember this other moment where this guy had super Tourette's syndrome, and that's what they called it at the time. And he would just get stuck in these moments where he'd have to look through his fingers and then count to 3. He had these really strong OCD symptoms, and he would repeat himself, and he would just start crying, and he would just be like frozen in these moments. And we had a family night, and his dad came, and his dad was the last one to show up, and all his dad talked about was his party that he had with his Princeton alumni boys, and the kid said to the dad, "Dad, do you understand that I'm in a psychiatric hospital right now? You're talking about yourself. Why are you, can you focus on me? Just say hello to me, connect with me." And I thought it was such a great moment that this kid spoke up for himself, the courage that it took to talk to his dad. And his dad said, "Oh, I could see you're really upset. This is a bad time for me to be here." And then he left. And I just remember how crushing that was. And I thought from that standpoint, the message was people don't operate in isolation. They operate in a system. And you can see how a system can bury a person, keep them down, versus, sort of an environment where they can thrive and lift. And so from that moment on, I thought systems are important.
That's pretty profound, Rob.
Yeah, it is.
Master's degree in counseling.
Mm-hmm.
You eventually become a licensed professional counselor.
Yep. Mm-hmm.
And talk about some of your experience after that.
Yeah. So when I moved back to Pennsylvania, worked for a summer at Montgomery County Emergency Service here, which is a crisis evaluation site. Thought it was a fantastic job because we did some immediate crisis work. It was an overwhelmed system. We had psychiatric prison inmates coming over in their orange outfits, shackled arms, shackled legs together. Yep. And I just remember trying to survive some of those moments. I remember there was this 350-pound man who was 6'4", and I was assigned to be his one-to-one for the shift, and I just took care of anything you need. He was doing karate. He was killing karate people that were trying to attack him, imaginary people that were trying to attack him, and everybody was really scared of him. But I was his best friend, his alliance. I knew that trust piece was critical for me getting through that shift. Yeah. And I just remember that moment. That was pretty cool. But probably my most powerful experience I've had as a professional was working at the Crisis Response Center in Philadelphia. And it was the busiest crisis response center in all of the city of Philadelphia. We saw about 15,000 people a year. We opened it up not knowing what to expect, and we had built staffing to look at maybe 10 to 15 clients coming through a day. Well, we hit on average 50 a day, and it was chaos, and police vans pulling in, people were on PCP and having to be put into restraint beds, and people that were shooting on the top of their roofs, and the SWAT team would bring people in. And it was every experience that you can imagine, just a whole range of diagnostic issues going on. And I just thrived in that environment. I just loved the intensity. People would come in with knives and weapons, and we'd circle around them. And I would de-escalate the person. I would, come on, let's ignore everybody here. Follow me into this room. We got this covered together. And I love being in that moment where I could help somebody that was really in distress. Mm-hmm. So yeah, some really amazing moments that really helped me define. It was an adrenaline rush. It was working with multi-systems. It was just really meaningful work for me. Yeah.
This job is tough.
Yeah.
Being a counselor and a social worker is tough. Burnout is high in the industry. Mm-hmm. We see that manifest in turnover, for example. Mm-hmm. Sometimes getting out of the field completely. Yeah. At any point, did you ever think about getting out? Did you ever have that crisis of faith? Is this what I was called to do? Have you ever second guessed?
I remember there was this moment. I ran a residential treatment facility, and it was the insurance company had decided they were going to take the worst kids from all over the country, bring them back to this residential program that we opened up. And they had not been outpatient for 3 or 4 years. So they were used to being, in locked facilities. And the idea was, we're just going to get them back in the community and sort of figure it out. Well, these were really tough kids. And these kids were breaking windows. They were on top of the roofs, creating fires and jumping on people's cars. And there was a lot of police involvement. And I remember sitting under a window, which actually wasn't a really good idea. This kid was throwing chairs through the windows, and he was doing a lot of destruction. I'm sitting there with another staff, and we're like, oh, wow, this is pretty intense. So I thought at that moment, well, maybe I should shift away from crisis work, but I thought I always would stay in the mental health field. So there's a point where adrenaline is a fun thing, but adrenaline can also wear you out. And I thought, hey, there were points where I was working some crazy hours and doing overnight shifts and going out to houses at 3 o'clock in the morning with police officers trying to arrange things. And I go, this is exciting, but I want to live a life of normality. And that's actually when I came to Lincoln Center.
Yeah.
So
I've spoken to a lot of counselors and social workers and other mental health workers, and there's a common thread in listening to their stories.
Yeah.
They had an experience, typically a traumatic experience in their past, and a counselor had made a big impact in their life. I see this with teachers as well.
Yeah.
People who have a calling to go teach they had a profound moment with a teacher in their youth, and it's like, I want to be that person to somebody else. But as I hear you telling your story, it's a little different.
It is.
It sounds like you just are here for the adrenaline rush. I mean, that's what I'm hearing, Rob.
That is only a part of it, because adrenaline doesn't keep you. It doesn't sustain your happiness.
So why is it that you're really in this field?
I'm in the field because I love people. I love relationships. I love the complexity of the mind, that where you can, if you can figure out a way for a person to do their life a little bit better and take away their pain, like that's a happy moment. That's a meaningful thing. I don't think you can be more meaningful than that.
Yeah.
Like, it's not about money. It's about the person. It's about walking through a journey with another person and getting them from point A to point B. That sense of hope that you can inspire somebody, that you can be a difference maker, that you can put a person at ease, like that is amazing stuff.
Yeah, you just touched on one of our core values, which is what we call meaning making.
Yeah.
Trying to work with every client, or in the context of the school, working with every student, helping them see meaning in their choices, connecting them to a higher purpose. Every action that they take and choice that they make has consequences that can be very meaningful to either them or to others in their life. And then I also heard you in your sharing just now another core value, which is personalized support.
Yeah.
Being there right with each person, right every step of the way, meeting them where they are.
Yeah.
Like the story of the person seeing something under the bed. You know, it's like you jumped in right there, and like we're in that moment with that person. Not necessarily seeing what they were seeing, but participating in that intervention. You were very active in that intervention, and not just like, and you, the fact that you were a young man, right out of bachelor's or right out of undergrad, I can't imagine the wisdom it would even take to be in that moment. So you have a gift for it, I guess is what I'm trying to say.
Yeah, it was instinctive for me.
Instinctive, that's the word I was looking for.
Yeah.
And so
I enjoy the moments that I witness through the other staff, through the programming we have here at the Lincoln Center. When I go up to the Leadership Academy that is run by April Thomas, I just see this family support environment where people are loving and caring, and it's about the relationship. And I see these kids thriving because here are a bunch of great mentors that are making an impact on the students' lives. So when I see that, it just warms my heart. And Lincoln Center is a lot about that, just authentic relationships, just really making an impact in systems, whether it's at schools or hospitals or community settings. We're there, we're real, we're genuine, and we're trying with all of our heart and our soul to make an impact.
Yeah. And every once in a while, there's an adrenaline rush, too.
Okay, I'm not taking away the adrenaline rush. I do love those moments. When it gets boring around here, I have to create a little chaos. I don't know if you've noticed it.
Yeah, I have noticed that. Well, let's talk about that, Rob. You've got a lot of energy.
I do.
You're bouncing around all the time.
I do.
What kind of things do you do to take care of your own mental health? We talked about burnout in the field.
Yes.
We talked about, in previous podcasts, we talked about vicarious trauma.
Yeah.
Trauma that the healthcare worker has experienced. Some of that transference that happens. Actually, why don't you explain for our listeners what vicarious trauma is? Yeah. And then after that, what do you do personally to manage your own mental health and
So
physical
this
health.
is like a two-stepper question.
That's a
This
two-step.
is your first time.
Well, and you may
hitting
forget
me with
halfway
a two-
through what the second
You might
question
have to
is.
remind me.
Yeah.
Yeah. So my definition of vicarious trauma is someone who has been in a situation where they've experienced something extreme. It may not impact on them directly, but they were part of, like whether it was a shooting or it could have been in growing up in an abusive environment. How that internally impacts on the person. It rewires the brain. It makes the person become over alert to any situational change. It changes you from a mindset of thinking rationally and long term to minute by minute survival moments. So people need recovery. They need to revisit that. They need to be in a safe setting and sort of reset and reprogram to sort of get past that vicarious trauma.
Yeah, and by the way, the Lincoln Center does some of this work with, for example, first responders.
Yep.
We have a lot of contracts with local police departments
Yep.
and and we are in hospitals as well.
Yep.
Working with first responders, and sometimes the workers in the field, their own mental health is overlooked.
Oh,
and,
yeah.
And so, as the Lincoln Center, we acknowledge that, we realize that and we provide a service.
Yeah, it's such a great resource to the community. Being in those emergency rooms, whether it's with gunshot victims, whether it's working with police officers who are dealing with that high intensity every day. I remember working at a crisis response center where police officers would just hand over their guns and go, "I'm done. I can't do it anymore. Please get me help right away." So that type of impact of stress and trauma every day can wear you down. So to get to the second part of your question, look at me, I'm the one getting us back on track here, or at least staying on track, I think that, first of all, I think genetically I'm wired to be positive. So I don't think it's a choice almost. I think that I just view the universe as this like fun playground, and that anything is possible, and that hope it always has to be there, and there's always a way through. So I think that that could turn some people off, but I know that's just who I am authentically. And I think that helps with my mental health. But I think I'm also very much in tune with mind, body, and physical activity is really important to me. So I play tennis, not terribly well, but tennis 3 or 4 times a week. I hike, I do biking, I am kayaking. We bought a couple kayaks. We just stay really active. And I think that that's an important element for me being happy with myself when I physically feel like I've spent energy, and I just feel calm and relaxed because of it. I think having a really strong family life. I have 3 children. I'm married for, it's going to be 25 years in 2 weeks. I'll be married for 25 years, yeah. So I feel like my family life, my relationship with my siblings and my relatives has always been a source of strength for me. So I have much gratitude, and I'm blessed to really have those areas in my life that I'm able to do on a daily basis. And I think that centers me, and it keeps me sort of in a space where I can smile and laugh and enjoy the people around me. I love relationships. I thrive off our office energy here. We have a great group of people that care about each other, that work collaboratively.
You mentioned a couple sports.
Yeah.
You mentioned tennis. You mentioned kayaking.
Mm-hmm.
Tennis, I could see the relationship piece, right?
Yeah.
You dialoguing with the person, having fun with the person.
Yeah.
Kayaking, that's more of a solo thing, isn't it? Or are you kayaking with other people?
So I usually kayak with my wife. We
Okay.
kayak together, but we're on separate kayaks. We're not in that tandem where we're so close to each other. We don't have any
Right.
space. So for us, that works for us. So we're going
What
down.
about tennis? Does your wife play tennis with you?
She has not historically.
Does she at least watch you?
She won't watch it. She's not interested in that area. What I like about tennis is that it's It's a workout. It's sometimes 3 hours long. You're running around till you're soaking wet, and you're reaching as far as you can to sort of come up with a way to win. And I love the mental strategy part of tennis. That if you keep trying to overpower a person, or you keep going the same way that you go in the beginning of your match, you're going to lose the match. You have to constantly shift and change and adapt and find the weaknesses and find something that's going to be more effective. And I feel like that applies in life.
Rob, as we finish up,
Yeah.
the state of mental health in our country, you've been in the field a long time.
Yeah.
And I'm a relatively newcomer.
Yeah.
Has anything changed? And I've heard two thoughts on this. One is there's nothing new under the sun, and the mental health problems have existed since eternity past, and it hasn't necessarily gotten better or worse. It's like just a condition of, it's basically a human condition.
Yeah.
I've heard others say that it's definitely getting worse, particularly external factors like social media add complexity, add a new factor or variable that wasn't there before that particularly affects our youth. And there's a whole new set of problems that crop up because of, say, new technology in that example. And I've heard others say that it's getting better because we have made advancements in medicine and psychological treatments, and we just know more.
Yeah.
And when I look at the data, you can, based on what your hypothesis is, you can find data to support all three of those. It's getting worse, it's getting better, and or nothing's really even changed. I'm just curious what your thoughts are.
Yeah, I mean, so again, I'm going to come from a positive framework. I think like 30 years ago, there wasn't a lot of community resources for mental health for people that were struggling in the system. People were, sort of redirected to forensic systems because the community didn't have the support level. Today, community resources are flourishing. There's a good amount of funding that's available in communities, and people are able to have an impact on a preventative standpoint, not a reactive standpoint. So to me, I love that part where politicians and the systems of schools and the environment, people, the families are able to sort of not sweep something under the table that needs to be addressed. So I feel that we are in the best place we've ever been in terms of access to resources. But your other issues about technology, about the impact of COVID, about impending disaster happening, whether it's with wars and, kids today growing up have to deal with a lot of adult issues and have to deal with, like, what does the future hold, whether it's about the environment or anything, any aspect of life, that there's a tremendous amount of anxiety and stress, unprecedented in any previous generation, I feel. So their capacity to manage that and their ability to, sort of do life and be successful, they have to be warriors and strong and capable and confident, and it's really vital that we help support them in that. I
think that's a good place to stop. Yeah. Rob, I appreciate you intentionally spending 30-some minutes with me.
This is crazy.
That was really powerful stuff, Rob. I appreciate you sharing it.
Okay, cool. Pleasure hanging with you, GT.
TLC Connections is supported in part by the Lincoln Center for Family and Youth through education, counseling, coaching, and consulting. We empower people to make positive choices, meaningful connections, and transformational change. To learn more, visit thelincolncenter.com.